All right, welcome to class, everyone. Trevor Mashak here, and today we're going to be talking about just kind of some introductions into wilderness medicine in general, and then we're going to discuss patient assessment and how you should kind of go about approaching emergencies in the wilderness or mountainous setting. So this should be kind of a first time for some of you. Some of you might have previous experience in wilderness medicine. Regardless, we're going to talk about some of the factors that are involved in wilderness medicine that change it from, say, urban EMS or in-hospital medicine, and discuss how those factors come into play when we're dealing with patients in that setting. So wilderness medicine, let's kind of just come up with a brief definition here. As you can see, wilderness medicine can encompass a lot of different situations. So up here in the top left corner, we have what looks like a technical rescue in a canyon that contains water. So they're actually using a special kind of litter here. It looks like it has floating capabilities. The team is wearing wetsuits, and they've got technical equipment. It looks like someone's got a descent device here, so it looks like they're going to be having some technical problems or obstacles, so it looks like they're going to have some vertical components there. Up in the top right corner here, this is a great photo from one of my buddies and also coworkers here, Dana Bruzzo, who you'll meet in a different lecture. So he was actually out in the wilderness just recreating and twisted his ankle a good mile, 2 miles away from the car, and didn't have an extensive med kit with him, and so he actually was able to use a stick and some clothing and some rope and actually improvised a splint. Down here in the bottom left, we have one of my classmates from a few years ago. It looks like she has a patient inside of a tent. We can tell that it's dark. She's wearing a headlamp, and she's actually starting an IV on this patient. You can't really see that too well, but she's actually about to insert a needle into this person's arm and start an IV. Bottom right corner here, we actually see, you can't really see the entire photo that well, but what we have here is a technical operation. Rather advanced skill. It's called a guideline. Pretty advanced technical rescue system. But basically, what we can see here is that there's a wide variety of things that fall into this category of wilderness or mountain medicine. Sometimes we have specialized resources. Sometimes we have extended patient care in less than ideal settings. And then in other times we might have to improvise. We might not have the medical equipment that we'd normally want or that we normally have, and so you have to kind of figure out a way to make ends meet, be it by technical rescue, specialized resources, evacuation, or just your patient care in general. So wilderness medicine, we typically define it as rural, remote, and resource limited. So in general, when we talk about wilderness medicine, you can expect to have limited resources. So we're not carrying in all the medical equipment that you'd normally have on your ambulance. We're not carrying in cardiac monitors. We're not carrying in these huge bags full of medications. Oftentimes we just have a very small pack, what we're able to fit into our backpack in addition to our personal gear. Typically we have extended patient care. So even, say, if something happens up in the Sandia Mountains, if you're familiar with the Albuquerque area, while you can see the city, you can see that you're very close. You might even be able to see where the hospitals are. You might be with that patient for a few hours. You might even be with them for half a day, a full day, maybe even longer than 24 hours, depending on weather and resources that are available. So typically with wilderness medicine, we expect to have extended patient interactions and patient care. Something else that we usually have encompassed with wilderness medicine, and this is highly variable depending on where you are, but typically we expect to have some increased hazards, be it from the weather or from the terrain. So you might have a steep or vertical terrain with loose rocks, such things like that. Or you might just have a hot environment, a cold environment. Those can absolutely be hazards to both the rescuer and the patients. We'll talk a little bit more about different factors different stressors to the patient and the rescuer here in just a second. But in general, that's something that kind of gets lumped into wilderness medicine. Depending on the environment, we might have different challenges. So we saw in that picture of the people doing the canyon rescue, they obviously had some very specific challenges that you might not run into given the environment. If you're in a desert environment, that's going to be very different from an alpine environment. That seems kind of intuitive, but basically what you need to recognize is depending on the environment that you're going into or the environment that you're going to commonly operate within, you need to be prepared for the specific challenges that occur in that environment. So be it avalanche rescue, be it cave rescue, whatever it is that you think you'll be encountering, it's important that you prepare yourself for those specific challenges that you might be facing. In general, our medical care and our assessment changes a lot when we're in a wilderness environment. It's nice in the hospital setting because we have blood labs, and we have ultrasound, and we have cardiac monitors, and we have CT, and we have X-ray, and all these tools that are wonderful for our patient assessment. But in the wilderness setting, oftentimes we have to limit what we're actually able to do. Sometimes you're not even able to take a blood pressure in the wilderness environment. You just have to go about your assessment in the best way possible. So you oftentimes have to kind of cut corners and in some regards find proxies for what we normally like to do. So, you know, we rely heavily on our physical assessment of the patient, which we'll discuss later on in the lecture. But when we lack these diagnostic tools that are common in the urban setting, we rely heavily on you know, how the patient looks, how they feel when you touch them, and the complaints that they're describing to you. With that being said, sometimes you actually do have some increased capabilities within the wilderness environment. For example, I've worked pretty closely with the search and rescue team in Grand Canyon National Park, and out there we actually carry portable machines that can test blood for various electrolyte levels and various blood labs. That's something that most ambulance services throughout the country do not have. That's something that if you're in Albuquerque, or if you're in Los Angeles, or if you're in Seattle, wherever it is, if you're in an urban environment and you're taking a ride on an ambulance, most likely they will not have that kind of capability. However, there are some parks that do carry tools so that you have better assessments due to the fact that we have extended patient care, and sometimes we are with these patients for longer, and they have serious problems going on, and so these tools could be very necessary. In the case of the Grand Canyon, the portable machine is called an iStat, and they get a lot of use out of it. It's actually a very important tool in their assessment and their management of patients that are experiencing heat illness. And then again, here down at this bottom bullet, I've already kind of touched on this. We understand that the time assessing and treating is generally extended. This can be highly, highly variable. If we're doing a technical operation, sometimes your time assessing and treating is actually going to be reduced just because you're not going to have access to the patient. They might be packaged up, they might be in a litter on a rope, in which case your time treating the patient is actually going to be a lot smaller. Your capabilities are going to be reduced. And so definitely, while in general our time with the patient is increased, depending on the type of mission that we're doing, the type of rescue, your patient care might actually be reduced. You might not have the same capabilities that you normally would. So in this course, we hope that you will gain kind of a basic understanding for wilderness emergencies, a general appreciation for them. We hope that you're able to assess, treat, and evacuate. Really, from this class, the biggest thing that you're going to get is the recognition of emergencies. So when we discuss the various types of emergencies that you might run into, I'm going to spend a lot of time talking about how you recognize these emergencies, how you know when the patient is going downhill, because truthfully, even at the advanced life support level, so as a paramedic, there's just not that much that I can do in the wilderness setting. We're just so limited that our patient care is really not as high as it might be in the urban setting. And so you really have to have this ability to recognize and assess patients so that you can get prompt evacuation when you know that they're experiencing something that can be life-threatening. So I want you to kind of keep that in the back of your head throughout this course. I'm going to remind you from time to time throughout our lectures that recognition is key, early recognition, and so that we can get the patient to the right facility, get them to definitive care promptly. What you might also find from this course is that you just want to know more. This is going to be about an 18 to 20-hour course. It's very, very basic. We're just going to be hitting on the fundamentals of emergency medicine. Likely you're going to find that you'd like more education. Certainly a wilderness first responder class is a great option. I highly recommend to everyone that they take an EMT level course or higher. Absolutely, getting your CPR certification is a must. I think that, you know, while we might talk a little bit about cardiac arrest and the pathophysiology of that, I think that CPR certification is absolutely important for everyone. But at the end of the day, you're going to get a certification out of this class. It's a 2-year certification, and that will be at the wilderness first aid level. And we'll send you out a little card so that you can keep it in your wallet. And that way you have proof of your certification, because you actually do get a certification through this course that is recognized by the New Mexico EMS Bureau and by UNM as well. So let's go on to talk about some of the stressors that we experience during search and rescue operations. This first line at the top is extremely important. So stressors in the environments and stressors during rescues apply both to you and your patient. So keep in mind that you might be able to cope with these stressors better than the patient. Oftentimes you will be able to cope with them better than the patient. Due to their injuries, due to their mental capacity, they might not be able to cope with these as well. So physical effort, by all means, rescue operations are oftentimes physically demanding. It's very important that if you are part of a search and rescue team, or if you take part in search and rescue events, it's very important that you take care of yourself physically. This is how you prevent yourself from becoming injured. The last thing that we ever want on a rescue is for one of our rescuers to become an additional patient, and probably one of the best ways to prevent that is just through physical training and just preparation in general. That's going to help prevent you from becoming injured or becoming susceptible to environmental hazards such as the heat or such as the cold. So for example, you know, kind of skipping down here, hot environments. Obviously here in the state of New Mexico, we deal with the heat quite frequently. It's very important that you take the time out of your busy schedules to occasionally train in the hot environment. Your body actually does adjust to heat quite readily within a few weeks of training in a hot environment. And you actually develop these proteins within your blood, within your cells, within your tissues, that help prevent heat stroke and heat illness from occurring. So you'll actually be less susceptible to developing heat illness if you train in the environment. It's important that you do it somewhat regularly. There are training regimens out there that you can probably find online. I'll try to post an article to the website that has some training guidelines, but you know, 2 times a week, 30 minutes or so in a hot environment should be enough for your body to start generating these proteins that will help you adjust to hot environments. Prolonged extrication, so this absolutely is a stressor to both you and the patient. So it's important that you take care of yourself. Don't let yourself become low blood sugar or dehydrated. Definitely make sure that you and your teammates are regularly drinking water, regularly eating snacks, and taking care of yourself that way, because when we start becoming physically fatigued and we start becoming dehydrated and our blood sugar starts to get low, that's when we become complacent, and that's when we start running into problems. So by all means, absolutely something that you should take care of during the rescue. Long-term patient care, we kind of talked about that one in the previous slide. You definitely have an increased responsibility. That you're responsible for yourself primarily, but you're also responsible for your team and your teammates, and then also the patient. As we mentioned before, you might be limited on resources. Maybe you're the single rescuer. Maybe it's just you and a partner. Sometimes you just don't have the resources available because in the grand scheme of things, search and rescue events aren't really a high frequency event. We see emergencies in the city all the time. We see fires in the city all the time. And because of that, we have ambulance services that regularly respond to emergencies like that. But in our case, a lot of rescue resources in the state are volunteer, and as such, sometimes you just don't have that big of a response to a mission. Certainly, changing conditions can be a stressor. It's very important that when you're on a rescue that you keep in mind not just what the weather is like right now, but what you think it'll be within an hour, 2 hours, 6 hours. You need to kind of keep that in the back of your head, keep that in mind, because certainly a nice, nice sunny day with a rescue can certainly turn into a pretty heinous operation if all of a sudden it's thundering and there's rain and it's flooding. So by all means, changing conditions can be a huge stressor. Cold, hot, wet, dark conditions, that kind of falls into these environmental factors that we talked about. You can imagine how changing environments, or just working in a cold environment versus a hot environment versus a wet environment, could result in some different stressors. We talked about technical complexities, so definitely can add some stress to an operation. Variable teams, sometimes you might have highly experienced people on your team, and sometimes you have volunteers that just have no medical training. And that's fine, it's great to have the additional help, but by all means, having a team of people that are less experienced or don't have a high level of medical training can absolutely add a lot of stress. It can make you feel like you have an increased responsibility as the sole person with the Wilderness First Aid certification. And so by all means, variable teams, the variability within teams can add some stress to your rescue as well. We talked about terrain. This whole idea of hurrying up and waiting. So you get the page out for a mission, you find out that someone's hurt, you hear that someone's ill, so you get in your car, you're driving, maybe you're going a little too fast, but you get to the scene, you're all gung-ho, you're ready to jump in the field and help out, and then incident base has you waiting at the scene for more information or for a full team to get there. And so this whole idea of getting up and going and then all of a sudden having to wait, that can absolutely be a stressor. That can also be the case when you get to the patient. So maybe you get to the patient, they're pretty injured, you busted your butt getting down trail, but then you get there and now you're waiting for more resources. And here you are stuck with a patient that might be fairly injured, they might be critical, and you're just waiting for more resources to show up. So by all means, that could be a huge stressor. Prolonged search, we see this a lot. The mental stress, the psychological stress associated with searching for someone that's lost. A search can go on for a day, 2 days, 3 days, a week, and that has that definitely has a pretty high toll on people, on the rescuers psychologically. They become very invested in finding this person, and the other end of this is that there can be a lot of psychological stress as well when a prolonged search comes to an end, when you find a deceased body. So absolutely, that can be a huge stressor in search and rescue events. Incident command, while we need a command structure, while it's very important for our operations, by all means, incident command can add some stress to the matter, just kind of the nature of the beast. Rescuer dynamics, maybe you don't see things eye to eye as the other members on your team. And then communication. So communication is something that frequently is difficult in the wilderness setting, especially if you're in a variable terrain, if you have power lines or communication towers nearby that interfere with your communication. ineffective communication can absolutely increase the stress of the operation. So it's important for us to understand this concept of risk versus benefit. This is something that you probably do on a day-to-day basis, just in your everyday life without thinking about it, but sometimes when we're in a rescue operation, we're kind of outside our element and a lot of things are going on. It's important for us to kind of take a step back from time to time and think about our risk versus benefit analysis. And so when you're having trouble making a decision, or you've got a big decision coming up, be it how you're going to evacuate your patient, how you're going to maybe even access your patient, it's important that you think about the risks associated with one decision and then the benefits, and then kind of weigh those against each other. So you ask yourself, what is the risk to me or my patient, and what are the possible benefits? So kind of an example of this is perhaps you have a patient that maybe they've got a broken leg. Let's say it's a broken tibia fibula fracture. And so you're concerned that the open fracture is going to become infected, so you want to call in a helicopter and have them hoist it out. So the benefits gained is that you remove the patient from the hazardous environment, and then you you decrease the amount of time that they're in the field and get them to definitive care much faster. The risks, depending on the weather, helicopter operations can be very dangerous. If it's very windy outside, or if it's if it's snow, if there's lightning, if it's dark, all those things can make helicopter operations quite dangerous. And so perhaps given the environmental situation, you decide that the risk associated with the hoist operation outweighs the benefits. So that would be a case in which you decide that it's too risky of a decision to follow through with. Risk in general, let's break that down a little bit. It's good for us to have a working definition of the word risk because it's very important in our line of work. So risk is the probability of an outcome and the consequences associated with that outcome. So you can have a high frequency event or a low frequency event, and then you can have a high consequence event or a low consequence event. And depending on where this event falls on the on kind of your chart, if you will, that determines how high a risk is. So I'm going to link a chart, we call it the stoplight chart, onto the website, and this kind of shows some different events falling in on this risk as probability versus consequence. It's also important to recognize that we have something called perceived risk. I don't have this written on the slide, but your perception of risk differs from person to person. So, we might be in a vertical terrain on a cliff face, and this is an area where I'm very comfortable because I've spent a lot of time climbing and a lot of time doing high-angle rescue. But perhaps this is an area where you're not very comfortable, and so you see this as a riskier situation. Perceived risk isn't just kind of a mental thing. It's not that you're, say, scared or that you're, a wimp per se. It's that you just don't have that experience. So in that case, your perception of the risk might actually be true. It might be a riskier situation for you than it is for me, given my experience or given my past experiences. So perception absolutely comes into this idea of risk versus benefit. This is something that should always go on, and throughout your operation, throughout your rescue, throughout your care of someone in the wilderness setting. And by all means, as you start thinking about this kind of stuff, probably the most beneficial thing that comes from this is discussion with your other teammates. And so if you have something, a decision that you're thinking in your head, man, is this too risky? Is this worth the benefit that we could get from it? By all means, that's the time when you should speak up and have a discussion with other people, because just discussing an event and a possible outcome with the other teammates is actually a form of risk mitigation. So just having that discussion not only makes that event less likely from happening, that possible catastrophic event from happening, just because now people are aware of that possibility, but it also helps us come up with contingency plans maybe an alternate plan or something, or our backup plan if that outcome happens. So by all means, risk versus benefit shouldn't just be something that happens in your head. You should be discussing this with your team members as you're going along. So what kind of stuff do we see in the wilderness setting? So this is one study done in Yosemite National Park out in California. They basically did a retrospective analysis, so they looked back in the past 10 years of the Park Service and what kind of emergencies they've seen. And this is kind of the breakdown that they came up with. So we have, by a large margin, over half of the calls that they experience out there are extremity injuries, so twisted ankles, broken bones, that kind of thing. And then, we have GI or stomach issues, altered mentation, it takes up a pretty good one. And then you can kind of see the breakdown as it goes. So chest pain, difficulty breathing, much lower down on the list. Now, of course, this is highly specific to Yosemite National Park. You probably wouldn't see these same numbers in your setting, wherever that may be. Certainly, I highly doubt that this is the same overview or breakdown that we see in the Sandia Mountains. But it kind of does give you an idea that while a lot of what we see is broken bones, we certainly do see a lot of other stuff. We see, obviously, some medical emergencies. People have a lot of different medical conditions, and a lot of times these can be worsened by exertion or by the environment. And so we absolutely do see those problems in the wilderness setting as well. It's not just all broken bones and neck injuries and the like.